Reversing PFS, reversing PSSD. In this video, I will talk about what test to take in order to find out more about your health when you try to recover from post-Finasteride syndrome or when to try to recover your post-SSRI sexual dysfunction. Okay, so the first thing I will check is brain inflammation. Neuroinflammation can be a little bit difficult to diagnose directly, but there are some specific biomarkers that you can check for this, okay? For example, IL-8, okay, is associated with chemotactic activity and neuroinflammatory responses, okay? So even EL or IL-6, okay, elevated levels indicate systemic and possibly neuroinflammation, okay? So you can also do tests for TNF-alpha, okay, because this is a major pro-inflammatory cytokine, often elevated in neuroinflammation, okay? So what else do we have? C-reactive protein, okay, hsCRP, okay? It's not brain-specific, but it will show us a little bit more about systemic inflammation, okay? This should be generally one test you should definitely do, okay? hsCRP or CRP, C-reactive protein, okay? Also great marker is S100B. It's really also indicator of brain damage, okay? So elevated in neuroinflammatory and neurodegenerative conditions, okay? So we have then things like oxidative stress markers, okay? And oxidative stress markers like 8-OHDG, it's a part of a Dutch test, okay? So the next test I would do is a Dutch test, okay? These are the urinary hormones, okay? DHT, DHEA, androstenedione, cortisol. It can also tell us a lot about 5-alpha reductase activity, okay, guys? In both PFS, PSSD, 5-alpha reductase activity is lower, okay, or almost no existent in some guys, okay? So Dutch test, okay? OAT test, organic acid test. Organic acids are products of body metabolic pathways, okay? So we can really, from this, we can evaluate gut health, mitochondrial dysfunction, neurotransmitter status, okay? So even indicators of detoxification, okay? So OAT test is also extremely important, okay? So stool test, okay? Stool test, like in PFS guys, for example, butyrate is effective, okay? So butyrate is needed to inhibit HDAC and reverse epigenetic modification induced by finasteride. So stool test can tell us a little bit more about our gut health, okay? So then we have a blood test, okay? Like I told you, hsCRP, ESR, inflammatory markers. I would check total testosterone, okay? So I think your testosterone should be minimum 500 nanograms per deciliter because you also want to have a adequate amount of DHT, because normally if everything running smoothly, okay, you should convert at least 10%, okay? If you are not converting 10% of testosterone to DHT, there is issue with 5-alpha reductase activity. Prolactin, okay? Prolactin, from my experience, it would be good to have under 7 nanogram per milliliter, okay? Because prolactin will also block your 5-alpha reductase and enzyme activity. I have seen many blood tests. I see guys with prolactin over 20, okay? SHBG, a higher level means less free DHT and less free testosterone, okay? Androgens are needed even for proper nitric oxide in your penile tissue, smooth muscle health in your penile tissue, and so on and so on, okay? Free testosterone should be at least 2% of total testosterone, okay? DHEAS, okay, is 300 microgram per deciliter, okay? Should be higher than that, okay? So estradiol, like I'm saying in my all videos, should be somewhere between 20 to 30 picogram per milliliter. Guys, IGF-1 support 5-alpha reductase activity. In some guys, even if you are using DHT alternatives, okay, so like Proviron, and they see no effects, they should take a look at IGF-1, because IGF-1 supports proper 5-alpha reductase activity. Ideally, it should be over 200 nanogram per milliliter, okay? So also you need to check thyroids, okay, to also improve DHT levels, okay? And also it's good to know where is your fasting insulin. It should be under 10 micro U per milliliter, okay? So guy, if this video was helpful, please comment for algorithm and have a great day. Bye.